That's a good point.
Kids now, you go outside, you get burned.
That's a good point.
So, I mean, there's so many things working against children today being active.
Yeah, keep them inside.
And when you're not active, you gain weight.
Okay.
You don't, your cholesterol becomes kind of deranged because activity increases that good cholesterol, which helps prevent plaque from developing.
Okay.
And so if you're less active, those things don't happen. So that's why we can see those changes even in children.
Even in children. So the
early changes.
Early changes.
Not advanced changes.
So it's not actually plaque per se.
No. But you can begin to see the damage in the blood vessels that eventually will become a plaque that will cause blockage of a vessel.
New question though. Is there a test, say like I have a 15-year-old and I say, kid, your blood pressure's fine, your cholesterol, everything's good, all your numbers are good, but I believe you have something in your vessels that aren't right. Is there any way to test them without going into that vessel? No,
there really isn't. There's no low blood test you can get. There's nothing quick and simple. But for the most part, it would be almost unheard of to have a kid have clinically significant vascular disease.
Okay.
And the need and cost to develop a test to see if that kid is at risk for developing disease down the road, really it's not something we need to do because we can look at that kid's family history.
Okay.
Okay. We can look at that kid's behaviors.
All right.
And we can almost predict with some certainty if they're on the road to developing diseases.
So the 14 and 15-year-old diabetics that we find coming out with type 2 diabetes, we can almost be assured that, in other words, we can look at their diet and look at their lifestyle.
Right.
We don't need to, they can't go in with an angiogram or whatever at a 13-year-old. That wouldn't even make sense.
No.
But we can tell them, hey kid, if you're eating burgers and fries every day and you're sitting at home, there's something going on in your vessel that's going to pop up later. Right.
Instead of, with this generation now, if we don't kind of change things, instead of having these problems happen in your 60s and 50s and 60s, they're going to start to happen in the 40s.
Got it.
And that would be a shame. It would be.
Wow. So let's kind of let's walk everybody through. All right, sitting at home using a remote, not running and eating the sugar, fat, salt, and grease. So what's going on in that vessel? It starts with a streak first.
Sure, exactly.
And what is that?
Usually the first thing that's laid down in the inside of the blood vessel is like a fatty streak.
Okay.
You have excess circulating cholesterols. You may have excess what we call free radicals from high sugar, high fructose diets.
Right.
All of those contribute to cause little damages in the inner lining of the blood vessel wall called the endothelium.
Got it.
Once the endothelium or the inner lining of the blood vessel is damaged, well then the body kicks in to repair that damage. So the first thing that happens is cells begin to coalesce, meaning gather around the damaged blood vessel. Once cells start to kind of coalesce around the damaged area of the blood vessel, it attracts other chemicals there, and eventually you get a reaction whose end result is calcium deposition. Inflammation almost anywhere in the body eventually leads to calcium formation. And then once that calcium begins to deposit in that wall, that's when you get the inside of the wall of the blood vessel getting narrow and narrow and narrow. And that's when you get blockage to wherever organ that blood vessel feeds down to.
Okay, and the blood has to go through. Now, question now, you speak about inflammation. When we think about inflammation, if I cut my hand, it's going to swell up and a lot of pus and everything. Is that the same thing going on the inside of the vessel?
No, that's infection. So there's inflammation and then there's infection.
Gotcha.
So when you have an infection, thank goodness we have inflammation because the inflammatory process helps fight the infection.
Gotcha.
Okay? All right. But there's inflammation without infection.
Okay.
And that's what happens in vascular disease.
Okay.
When you have the things that predispose you to have vascular problems, too much sugar in your blood vessels, toxins from cigarette smokes, high blood pressure where the heart is pounding hard, pushing blood way too hard against lining of blood vessels such that the blood vessel lining kind of comes apart, damages, and then the body tries to fix it. That's an inflammatory process that tries to repair that.
Wow.
And the end result of all this inflammation that occurs in blood vessels, it typically is plaque deposition, calcium deposition.
All right.
Once you get that, the blood vessel begins to narrow.
It narrows, and we got to get to this. I hope everybody's excited as I am. High blood pressure, because people don't take their medicine.
Sure.
They're like, forget this. I could care less what my pressure is. Unless I have a headache,
right.
I'm not taking medicine
right.
when my pressure's high. But what you're saying is that even though there are no symptoms and the pressure's high, that what's going on now is pounding
right.
again.
Right. Because it's those blood cells, red
okay.
blood cells,
all right.
are being forced into blood vessels at a part per square inch pressure rate
okay.
higher than what it should be.
Okay.
The heart has to pump harder
right.
because the blood vessels are less elastic than what they should be.
Mm-hmm.
And when the blood vessels become less willing to relax and receive a red blood cell, right. it kind of fights it. And then eventually something has to give. And what gives is the cells that line the inner blood vessel kind of come apart from each other because they should be well connected.
Right, right.
But if you're getting bombarded with red blood cells coming at these connections at a force that's higher than what it should be, eventually these tight connections become looser connections.
Okay.
And then once you get looser connections, it starts a cascade of inflammation where the body's trying to repair this. And that eventually ends up to being hardening of the arteries.
I mean, we've looked at some studies where, particularly in some neighborhoods, over 40, like 70% of the people, 80% of the people over 40 have high blood pressure.
Right.
You know, in some neighborhoods, and nobody's controlled.
Right.
You know, forget it, because
right.
there's no headaches and there's no problem, silent
right.
killer. So the damage is going on the inside of the body in those vessel walls.
Yeah, and it's happening continuous with each beat of the heart. So
wow.
that's why we always preach blood pressure control. You know, and a lot of what we do essentially, and we talked about education, a lot of what we do as vascular professionals is educating people. Because most people think that there's nothing you can do about whether or not you're going to get vascular disease.
Right.
You know, it's in my genes.
Right.
You know, we talked backstage about stroke. You know, how many people in our community, especially culturally, think, you know, if Big Mama had a stroke,
mm-hmm.
you know, or Papa had a stroke, you know, it's because he had an aneurysm.
Right. Well,
the reality is, Chris, as you know, is that rarely do we die of strokes caused by aneurysms. Most of those strokes are caused by blood pressure that's out of whack. Blockages in the neck that have come from smoking or diabetes or other things that inherently could have been prevented. Oftentimes there were signs and symptoms before you had that stroke, such as tingling of the fingertips,
right.
inability to use the arm for a short period of time,
right.
visual changes like someone's pulled a curtain over your eye, slurring of speech.
Okay.
Usually all those things predispose before you have a stroke a lot of times. So no, you know, Big Mama didn't die of an aneurysm in the brain.
Right.
She died because her diabetes was never under control. She never took her blood pressure pills. She was probably 50 pounds too heavy, you know, and didn't exercise.
Most of the people who die in Louisiana, disease-wise, I guess, young folks is gunshots, but for the most part, like you said, just dealing with those clots, venous clots, is more than AIDS and breast cancer, and that's the ones that scare people. But we're dealing with vascular diseases, cardiovascular disease.
No, I like throwing that little figure out there because it gets people's attention with venous disease. Yeah. But the reality is, when it comes to the overall rankings and the cause of death, you know, AIDS, breast cancer, you know, venous pulmonary emboli, they're essentially not that significant when you look at the main causes of death, such as cancer, pulmonary diseases, and stroke. Stroke is the fourth leading cause of death. Right. Coronary disease, heart disease, the second leading cause of death. Coronary disease, heart disease, leading cause of death. Third leading cause of death is lung disease, you know, COPD. Fourth leading cause of death is stroke. So, you know, AIDS, blood pressure, breast cancer, and all those, they're very low on the risk. But coronary and peripheral vascular disease are very high in the top 5.
Would you say that?
And cancer being number 2. I forgot to say that.
Yeah, but the cardiovascular disease or whatever is way higher than cancer if we line them up.
No, cancer's number 2.
Number 2?
Yeah, heart disease number 1, cancer number 2.
Okay.
Pulmonary disease is number 3.
All right.
Stroke number 4.
Okay.
And stroke used to be number 3 until recently.
Interesting. Question then, though. Is all cardiovascular diseases preventable?
Not all, but the significant portion. You have some people who just no matter what have the genes that are responsible for deranged blood vessels, okay?
Okay.
Have the genes that code for aneurysm formation.
Okay.
Okay. That's not the vast majority of people who keep me up and at work every day.
Say out of 100 people, any figures just to throw them around
sure,
or whatever?
Less than 2.
Less than 2?
Less than 2.
So rarely
right.
are we dealing with somebody who, okay, there's nothing they can do about it.
Exactly.
So these things are, for the most part, preventable.
Yes. Inherently preventable, and can almost always be attributed back to how you've cared for yourself and your habits.
Interesting. We're about to close, and we dealt with high blood pressure, but we want to deal with diabetes.
Sure.
The pressures, again, is separating those cells or whatever, and it's creating that problem. But sugar in the blood.
Mm-hmm. Sugar in the blood is inherently not a good thing. The excess sugar deposits in a different layer in the blood cell called the basement membrane, which is more of a reinforcement membrane in our blood vessels.
Okay.
And like I said, our blood vessels need to be very pliable. Okay? Mm-hmm. They need to be able to relax and constrict. Once you begin to get thickening of the blood vessels as a result of, say, sugar deposition over a long period of time, they get stiff. Right. And you no longer have that ability to kind of have the blood vessel relax. They also become less responsive to different hormonal type substances in the bloodstream that the endothelium cell, which is the inner lining, that they produce. Right. Because relaxation and constriction doesn't just happen. There are substances that are secreted to make that happen. Okay. Once the sugars begin to damage and thicken these walls, it prevents all the reactivity from those medications and substances from happening. In addition, when you have excess sugar in the blood, it causes free radicals to be of excess in the blood. Free radicals are basically charged molecules, you know, with either positive or negative charge, which tends to damage the surface of a blood vessel. Wow. When you get damage in the surface of an inner lining of a blood vessel, that's when you start the cascade of inflammation that can lead to blockage formation.
So we have the control.
We have all of the control.
Major. We're about to close. Any special points you think that the audience needs to understand, just to sum it up?
Sure. At the end of the day, education is the key to all these problems. All right. If we can just do certain small changes in what we do in our lives, we can make big changes that will affect all of us individually, but also as a nation, we'll be much healthier, and as a community, we'll be more productive. But it all starts with what we decide to make changes with.
Dr. Sam, I think this is awesome. I'm excited. Again, this is Health Issues. Chris Sylvain, your host. You can catch us on the web, healthissues2010.org. Hey, be a preacher and tell everybody how important it is. Keep your blood pressure under control. Keep your blood sugar under control. But you have the control. Don't blame it on mama and daddy. You can make a difference. Thank you. Fight as hard as you can. Appreciate you.